some of those principles that really stand out to me that are applicable in practice are tole totem. That's Latin for treat the whole person.
Oh, like that.
Yeah. Tole causum, treat the root cause.
Yes.
There's also docere, the importance of teaching. Doctor as teacher. What we're doing here, so many lifestyle habits could be modified that are leading to disease with just education. And then there's another one that I love, which is the vis medicatrix naturae. So the healing power of nature. The healing power of nature. That we have this healing force flowing through us that is innately organizing and self-healing. And if we simply support the body and we stimulate that, we can restore health back into ourselves. Creating opportunities to heal and openness to letting the body heal itself. Restoring health. Reminding them that, and I actually have this on my business card, that health is our birthright. And so we're simply restoring what's been promised to us. What is ours? We're just claiming it.
Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Welcome back, everybody, to the Functional Code. We have an exciting guest today here, Dr. Alan Maxwell. Now, Doc and I met back in a conference 10 or 12 years ago, so super excited to see him again today. We were learning about ozone at this conference, and so I know that Doc has taken from what he has learned at that point in time and expanded exponentially how much he knows about the body, and we're just super excited to jump into that today with him. Dr. Alan Maxwell, thank you so much for being here today.
Yeah, thank you guys so much for having me. It feels like such an honor to reconnect after so long, and I'm excited to dive into it, share with you guys what's happened since then, and just raise awareness for a lot of good modalities and a lot of powerful medicine.
Absolutely. We appreciate it. Thank you so much. You run the Applied Wisdom, you and your partner, run Applied Wisdom Health Institute, and it was founded by your father. And then you guys took it over, and this location you're at now in Arizona, you took that, or you moved that location, and when did that start?
Correct, yep. So we started the AW Health Institute in Tempe 2 years ago.
Yeah.
So it was around November of 2022 that we got the keys for that space, opened it up January of 2023.
Perfect.
And that we had moved from the location where my father was at since '96. It's where he started AW Health Institute. He had started a lot of practices in his time in his career, AW being the most successful because of, I think, geography, the clientele, a lot of snowbirds, winter visitors that come to Arizona, as you guys know, especially that Yuma, Arizona area.
Yeah.
The town in Mexico where he was at was Los Algodones, Mexico, a little border town, which interestingly enough in 2012, I believe it was in the Guinness Book of World Records for the most dentists per square block.
Really?
Anywhere in the world.
That's funny.
You walk across the border and it's just pharmacy, optometrist, and then a couple medical offices.
Yeah.
My father's being one of them. And so we had managed that for a while after he passed in 2020. And it became just a little difficult logistically to be going there, coming back here. That's when we decided to open up the AW Health Institute in Tempe.
Yes, beautiful. Yeah, beautiful. I'm super excited to get into everything that you guys do in your practice, and I'm looking forward to speaking about this with you. So as always, I am Dr. Addy.
And I'm Dr. Jace. And yeah, today, just from the brief conversation that we've had, I can tell that you're an awesome soul. You have a lot of knowledge to give, and we're super grateful that you're here too. We're going to be diving into a bunch of things in terms of ketamine therapy, in terms of other things of your specialties or background in hypnosis, NET, Reiki, NLP, craniosacral therapy, and then probably many other modalities, if we will, on that one. Doc, curious, how were you first introduced into medicine, and did you always believe you were going to be a doctor?
Yeah. So I think I was really blessed to be one of the, few docs nowadays that grew up in this field. There's definitely a lot of second gen out there, but maybe not many. And so ever since I was little, I grew up with my dad giving me a pill for this, or telling me, son, if you're coming down with a cold, take this magnesium chloride, mix it up in some water, interestingly enough, and you take that. Not a lot of research to support that, I've come to find out, but still something I would do as a kid.
Yes.
Tasted horrible because it was just magnesium chloride crystals mixed in water. And so I grew up used to taking all kinds of things. I would also, at one point, walk home from school. It was like, and this is actually answering the second question. When did I know I wanted to be a doctor? When did I decide that was a path for me? It was about 4th grade. We were living in the back of where my father and mother had their office, in that border town I mentioned, Los Algodones. It was 4th grade. I walked home from school, and often when I'd come home, my father would ask, do you want to come into the treatment room? I'd knock, I'd let him know, hey, I'm back. This day he said, hey, come on in. He asked the patient, is it okay if my son joins? She was like, absolutely. So I stood near the door, and he was giving her a treatment of neural therapy. Yep, something from Germany, something that we do at AW quite a bit actually for chronic pain. He modified the formula slightly, and we can get into that if we want. It's actually a very effective form of injection therapy for chronic pain. But in this case, I remember the woman being in her 50s or so, and she had chronic pain for 16 years. She wasn't a surgical candidate, and she had been hooked on opiates for 16 years. And as she was telling my father the story, I remember her tearing up, because she went on to say how she had lost her family. Like, the opiate addiction that she had developed had just ruined her life. She couldn't work. She became just apathetic. She couldn't show up for kids, her husband. Really sad story. And so he said, okay, let's do the treatment. He did the neural therapy on the back, and she had even nerve blocks and all kinds of things that you would expect it to give temporary relief. In her case, nothing ever gave full relief, even with higher tier interventions. She got the neural therapy treatment, stood up, and then he asked her, like, how was it? And she just started to bawl her eyes out. She couldn't even answer. She was just tearing, crying, and when she finally was able to say something, she just said, it's gone. It's gone.
Wow.
And I saw that, and it left this huge impression on me. And it wasn't until that moment, it's so interesting.
Yeah, sorry.
Oh, wow. Yep. No, that's a powerful, story to share for me, and, for others when they hear it. And I think because deep down we know so many people are in situations like that.
For sure.
And sometimes for someone to know their purpose, all it takes is one experience, one profound, life-changing experience, even if it's not in our own life, someone else's. And so I saw that, and from that moment I was like, this is what I want to do.
For sure.
I felt it. And I didn't have a strong connection with God then, but I think I still felt deep in my soul, oh, this is what I'm here to do.
Felt that calling.
Yeah.
That's cool.
Yeah.
Has it always been alternative, or did you ever think more modern to start? Where did that thought process come in?
Yeah, so interestingly enough, since my father was operating as an MD, he had an MD-like license in Mexico, I knew he was doing integrative medicine.
Okay.
But what I was most familiar with was actually this idea of being an MD. And so I knew he had a chiropractic degree.
Yeah.
I knew he had gone to ND school. But what I knew most of is him as an MD.
Okay.
So actually, it wasn't until being an undergrad at the University of Arizona and pursuing a traditional medical degree,
Okay.
and wanting to go into integrative medicine, it wasn't until that point that I ended up making the switch to go to naturopathic medical school. Yeah.
So you were actually doing a pre-med medical degree.
Yep, completely traditional. I was in their physiology program.
Okay.
I was involved in, at the time, University Medical Center, which is now Banner. I think Banner
Sure.
bought out U of A's medical school or medical department. And that is, what I was set on, still wanting to practice integrative.
For sure.
However, but wanting to go that route. And it was actually really interesting. It was my senior year. It was a time to be applying to med schools, taking the MCAT. And this other friend of mine who was going the traditional route, he's, Alan, you're so into holistic modalities. You're always talking about a vitamin and herb. Have you looked into a naturopathic med school? And interestingly enough, I had looked into it very briefly. I had a partner at the time that also was wanting to go into medicine and was actually leaning in that direction. It was so interesting. But I hadn't looked into it. But I said, okay, before I get to the point of no return, if you would, not that I couldn't go a different direction, but I thought, okay, let me get really clear on what the medical schools are going to be diving into, what the curriculums are going to entail. And so what I learned is that going that integrative route, the courses for the integrative modalities would have all been as rotations or fellowships after completing the 4 years of medical school. They weren't integrated into the medical school curriculum. There wasn't courses. When I looked at the ND curriculum, it included so much of what I was interested in. It's at the Southwest College of Naturopathic Medicine where I went, which is now Sonoran University.
And that's in Arizona.
Here in Arizona, in Tempe, just a block north of where AW is. We didn't make it far. Yeah, we stayed really close by. Their curriculum included botanical medicine, physical medicine, traditional Chinese medicine. And there was doctors that had rotations on IV therapies, regenerative injections.
That's incredible.
The list went on. And so I was like, wow, maybe I've had it wrong. And maybe I do want to actually spend time learning what I know I'm interested in and passionate about. More than 4 quarters of nutrition.
That's probably the most, if not all, of the providers. We had a good amount, but we had nowhere near that amount.
No, most don't.
No.
And at the U of A, it would have been 1, briefly touched on.
And that's where 98% of people are going to. These medical providers who want to probably help these patients, but don't have that kind of background, so they do their best.
That's right. Yeah.
And they just use what they're taught. I think a lot of them that don't get exposed to a mentor in the holistic space, they think if there was something to that, I would have covered it. I would have been taught it. And so if they don't take the education into their own hands, they miss out on such valuable information. And so I think having access to a program where they're teaching you that, and you don't have to spend as much time after the program, outside the program, diving into all those things, which certainly is still important to get the hands-on and the additional training. It doesn't completely prepare us for everything that we're going to practice, but I think that just makes most sense. Just get the most exposure and experience.
Absolutely, yeah. It's interesting that you have like that background already instilled into you from like your father, and God, I wish my parents had some of that background. And love and respect my parents, but it's cool that created that foundation, that seed that kind of grew into that mindset shift of what was available for you, and obviously you're doing incredibly well. So I guess from that side of things, did you have any other like key mentors or figures growing up outside your father in this field?
Yeah, I definitely.
He was one of the biggest, and one thing that he without him even knowing, he was a great teacher. And before I dive into those other mentors, just to show how great of a mentor he was, it was at like 10 years old that he was having shoulder pain. And there was a spot he wanted to inject on his scapula, and he couldn't reach it. He could do some of the rotator cuff up here, supraspinatus, but he couldn't get to this one scapular point. And so he said, son, I want you to inject me. 10 years old. I know, very brave of him. Being someone who's raising a teen, that took a lot of courage. And so he guided me through it. He's like, it's going to be okay. Just go right here, just straight in, and just quick through the skin, slowly move the needle forward, and you're going to hit the bone. And that's the spot. And he's like, just make sure you go in that direction, because if you don't hit the bone, you're likely going to miss and you may hit the lung. And he says that to me as I'm going in. It was pretty wild. If he wasn't so calm himself, I would have just completely had a nervous breakdown or was shaking too much. But he guided me so well, and so I got the spot, and it instilled so much confidence. And so I just saw him my whole life. I ended up working on him actually quite a bit at his request over the years. But so, yeah, he was incredible and huge mentor. I spent more and more time with him in undergrad and then in med school while he was here physically. But the other mentors that have been huge that I want to give a shout out to are One, Dr. Drew Timmermans. Yes, yeah. Dr. Timmermans is a legend when it comes to not only regenerative injections, but education, raising awareness. He's got an incredible presence on social media and just so much content. He just puts out so much.
He's made courses.
He looks like a maverick when I watch his content. He looks like,
yes.
Yeah, it's like he's an ND, but boy, has he really chosen his lane, and man, does he look like the absolute expert in it. And it's
100%. I see him in exactly the same way. He's just like a pioneer.
Yeah.
And just really fine-tuned, honed the craft, and is doing it at such a high level of like science-backed approaches with incredible hands-on and clinical experience, volume, numbers, and while still staying true to the naturopathic principles, and still supporting his patients to work on the lifestyle, the inflammation levels, so that they can get the most benefit from these higher tier injection therapies that he's doing.
So you've spent some time with him, and
does
he teach at the school too, or stuff like that?
He sure does, yeah.
Okay.
So he was one of the docs at SCNM, now Sonoran, that had a rotation.
Okay.
And so his rotation is just pain focused, injection focused.
Nice.
And it's actually at one of the community clinics. It's one of the clinics that's through one of the non-profit of the school.
Sure.
So they care for underprivileged individuals. And so it's super rewarding because they're able to get care that normally they wouldn't have access to. Modalities that insurance wouldn't cover, maybe they couldn't pay for. And for us as students, it's rewarding just to have like the volume to be working with patients that are often really grateful. They're just incredibly grateful that someone is willing to take care of them and not give them another drug. Work with them to lower their inflammation levels. We talk to them about lifestyle a lot too. And okay, we can do this injection therapy, but this diabetes not being under control is not going to let you get the results you need. The pain may come back. And so I think they really appreciated that we would take the time to just not just stick them, prod them, send them off.
And that's the part of medicine that's missing.
Yeah.
In the broad scheme of things.
Tremendous.
And that's not to say to knock medicine, but I do think most, even medical providers, agree that they wish that they could have more time to speak about that kind of thing with their patients. And I've spoken with MDs that feel that way. They really do wish they could incorporate more of that, which that's maybe a different conversation, but that's awesome because you spoke a little bit about this naturopathic philosophy. So I'm just curious, what philosophy does ND schools teach, and maybe just how does that play a role into the whole body and how you treat and how you run your clinic, if that makes sense?
Yeah.
So what I really love about naturopathic medicine is the philosophy. And so what sets it apart are a set of principles that we're all taught throughout that medical curriculum. And so some of those principles that really stand out to me that are applicable in practice are tole, totem. That's Latin for treat the whole person.
Oh, like that.
Yeah. Tole, causum. Treat the root cause.
Yes.
There's also docere, the importance of teaching. Doctor as teacher. What we're doing here, so many lifestyle habits could be modified that are leading to disease with just education. And so that's a huge one for me. And that's why I love this opportunity, because we get to get this information out that is literally life-changing for some. For a lot of Hispanics, they might not know that soda, that Coca-Cola, you know what I mean? Followed up with that tamale, that high-carb tamale is driving their diabetes. No one's ever taken the time to teach them. So that one's huge. And then there's another one that I love, which is the vis medicatrix naturae. So the healing power of nature. The healing power of nature. That we have this healing force flowing through us that is innately organizing and self-healing. And if we simply support the body and we stimulate that, we can restore health back into ourselves, which we know. And so we can do that through lifestyle choices. We can do that through, honestly, starting with another thing that sets the naturopathic medical field apart is the pyramid, our therapeutic order. is what it's called. And so we're all taught that there are steps and levels to treating an individual, a person, an organism. And so we start off with establishing the foundations to health. That's at the very bottom. Yep. What is that? That's good nutrition, sleep, low stress or stress management, getting out into nature. Things that, it's funny, things that are being talked about, like they're really cutting edge. Blue light blocking glasses and getting outside into the sunlight for infrared light and earthing. But it's so funny, and because we got so far away from that and disconnected, that now podcasts on those topics are just so highly sought after. But it's important, but just getting back to nature. And so that's at the bottom of the pyramid. And then as you go up the pyramid, you go to higher and higher force interventions. So then it might be, the next step might be something like hydrotherapy, hot and cold therapy, beyond just day-to-day activities. Now you're alternating 3 minutes of hot water with 30 seconds of cold in cycles of 3. Then it might be herbs and supplements, which, herbs, wonderful, could be used to treat the root cause, treat the whole person, but also could be used in a more, they call it green allopic sense, where you're using it to mask symptoms or to cover up symptoms. Now, there's a place for that because those herbs are going to have far less side effects often than the medication. If they're used at the right dose, still effective too. But you keep going up that pyramid and you get to physical manipulation, you get to regenerative injections, IVs, stem cell, PRP, ozone, and then eventually surgery as a last resort, which I think in many cases is where it ought to be reserved for. There's plenty of cases where it's going to save someone's life and it's got its place. But I think for most chronic diseases, there's no going back. Overutilized, exactly, with a big price often. You have scar tissue, you may have nerve damage, and so if you can use something that is not going to cause as much harm, go for it. It's a win.
I agree.
It's a win. Yeah.
Absolutely. We talk about that's almost every podcast. I feel like where we come from. Dr. Jace and I both agree that if there was one place that you shouldn't get surgery on, at least avoid fully, is the back. There's just isn't even research on it yet, and people are still doing it, unfortunately. But that's awesome.
I will say I see a lot of poor outcomes with the back. Interestingly enough, I have had several patients, and it blows me away. They've had complete disc replacements. Not here in the U.S. though. They go to Germany.
Yes, I've been hearing more and more about that procedure.
I didn't hear about Germany.
Yes, and I know this. It's maybe a smaller population of patients out there that are needing this, but the several patients I've seen that have gone to Germany to get this procedure done have these incredible outcomes.
That's awesome.
Not to say, hey, go to Germany, get a kid's going to replace all your
people are buying their tickets right now.
Right, but it seems like there are certain approaches, certain procedures that have better outcomes, and there's a place for them. They also weren't aware of a lot of the other things. They hadn't worked with a holistic practitioner, naturopathic doc, or functional doc. Interestingly enough, I asked them, what was that experience like for you? And they said, it was incredible. The day they got out of surgery, they started doing light physical therapy with them. They started doing acupuncture, massage. The food was impeccable, healthy, vibrant, and so it's okay.
What an experience too.
And no wonder the outcome was so much better. They already had a good foundations for health. They were giving them all the supportive care, and that higher risk, higher tier intervention didn't have as much harm, as many side effects.
That's funny you say that. I just talked to a nursing friend of mine who just finished a horrible cardiac case. And once they finished it, it was successful. But the gentleman ordered a cheeseburger the second after he got out of his procedure. And then my nursing friend was like, we can't do anything about that. But they're sitting there and allowing it, and he's like, it just doesn't feel right. And a lot of those providers feel that way, but they want to say something, but there's still this lack of, I don't know if it's autonomy or what, but it's just, when you mention all this, it's just, this is what we're missing. This is what we're missing.
If you are going to undergo a procedure that has a high risk and probability of causing long-term harm, do everything possible to mitigate that harm, to reduce it, to lessen it. And it's not being done. And I think, yeah, the systems aren't in place. I think in that hospital, wherever it is in Germany or over in Europe, they have the chefs. They're aware of that. They know how important it is to provide nourishment. The body needs the building blocks. Yeah, but it's lacking here. And since there's such a lack of just general awareness for the importance, the value of nutrition, I can see why it's, for one, tough to share that with someone as something that's going to be meaningful.
For sure.
But then two, if the systems aren't in place for them to have access to that, and they don't know where to send them.
Yep,
And
it's all we got to feed you today.
Yep, and that's not included in the cost. And so then they're going to have to pay out of pocket. And a lot of Americans are under the idea that it's actually more costly to eat healthy, which isn't true at all. They've shown those studies. I think it was like Fed Up, a great documentary that showed how doing combo meals at McDonald's for a family of 4 is way more than going and shopping the perimeter and getting a ton of veggies, getting the rainbow, getting some good quinoa, some veg, and then like a chicken or some fish, which is way cheaper. It's way more nutritious. But they're in the idea, oh, I gotta go get organic and grass-fed from a restaurant, and we can't afford that. It's like, no, you can eat healthy, affordably as well. Yeah.
And that's in the short term, but not even the long-term costs of eating that way. Even the short term it's cheaper, but in the long term it's cheaper, so that you're not having these incredible healthcare costs due to poor health from the way you've chosen to eat.
Exactly.
That way as well.
Yeah, and I think that's even harder for many to recognize.
Of course.
You know?
It's tough to look that way. Right?
Yeah, absolutely.
And then I know one key part to that premise that you just brought up too is the time aspect as well, because obviously we know it's cheaper to eat around the edges of the grocery store, but just the same as well of making the food, of knowing how to make the food. How deep do you guys go into, like, obviously these certain things are important, but do you have resources you use with patients in terms of like how to make some of this? Or how would you take that if a person was going to come to you and say, oh, I just don't have the amount of time, I have so many other things going on? I guess, how do you?
Yeah, that's a great question. When it comes to specific diets, we tend to use a more general guide and not get as detailed. There are patients that like that. They want the recipes to follow, and they want to know how to prepare it. And so we will do our best within the time that we have to maybe come up with a couple ideas. Yeah, a general breakfast, a lunch, and a dinner. And maybe not every meal, but we give them the general idea. And then with those couple examples, most are able to mix it up from there. You know what I mean? Okay, let's mix up the type of protein. This whole list of vegetables a go. But we're limiting often our like carbs. So it's really, okay, we'll avoid this, but we don't want to focus on what you have to avoid, because that can restrict the mind and you feel confined. And so let's focus on everything you can't have, which actually is a lot when you start going down the list. Yeah. And then for those patients that do want really specific recipes, we'll work alongside a nutritionist or we'll get a health coach involved that in some cases will even go to their home and go through their entire pantry and their cupboard, and we'll let them know, okay, these are things that are going to be supportive for the healing, for your goals. These are going to get in the way. These are going to be obstacles to cure.
For sure.
Yeah, and so that's how we approach that. Yeah, I'm a big fan of smoothies, personally. Yeah, smoothies are great. Yeah, I know, who doesn't? And I think if you know how to mix in the right ingredients, you can get a really nutritive smoothie, not just like a high sugar smoothie, but you can really create a dense meal from a smoothie, and they're usually pretty quick, and so that's an option we'll recommend to patients.
And I can help with it.
Exactly, yep, yeah, and then even meal prepping or preparing the night before, there's certain things you can do. And if people are really on the go, I say, okay, at the very least, ditch the bagel and let's get a protein shake. A company that I really love that has the ready-to-go proteins is someone like Orgain. And the Orgain, you guys may have heard. Yeah, you can get them at Costco. Big fan of Costco. I must say, friends and family that know me.
They've stepped up their product choice. I really
Yeah.
do think they've done a great job at including a lot of more healthier options for people.
Absolutely. Absolutely. Yeah. Very impressive with their
Selection. And even if it's like a plant-based protein shake in the morning, just grab that. You can be off to work. At least you're starting off your day with protein. It's going to give sustainable energy throughout the day and not just lead to a crash.
Right.
Yeah, soon thereafter.
So I would like to switch our mindset and maybe help audience members figure out, at least understand what it's like as a patient kind of entering your clinic and your space. And so the first question that I have is, what might be different in respect to a typical medical model setting versus a naturopath-led integrative model? And maybe just some highlights of things that they can expect and maybe experience-wise.
Yeah, absolutely. One thing that's going to be very different from the get-go, from the moment they call up and they book their appointment, it's going to be two things. For one, they're going to be asked by our front desk if they'd like a clarity call. And I think that is something that a lot of traditional practices may not offer. I'm starting to see that more and more. But it's a brief phone call or Zoom call for us to get an idea of what's their health goals.
Right.
What do they want to work on? What conditions are they dealing with? And that serves for us to know, okay, is it something that we're going to be able to support them with? Because they're, in general, we can support with just about everything. By using those principles I talked about, people are going to benefit and get value. But if someone's wanting, say, a specific outcome and they want it a specific way, that's important for us to know. Because maybe we aren't going to be a good match.
Sure.
The nice thing is that there are so many holistic providers out there that if we're not a good match, someone else will be. And so we'll be the first to let them know, hey, actually, I think you're going to be better off going this way. And I think that's important. So lets us know, are we a good match? Most of the time, we are in some way. But then two, they also get an idea of how we practice. We use that time to know, hey, are you willing to make lifestyle changes? Are you going to be okay with supplementation? What are you open to? What are you not open to? And from there, if they feel, okay, yep, this is something that I want to do, I'm ready to make changes. And not everyone needs to make lifestyle changes. I just will say, people are going to benefit from certain things like prolotherapy, whether you make tremendous lifestyle changes or not. But you're paying out of pocket. You want to get the best results. So the more changes you can make, the better the results. But then once they make the appointment, they're going to get our questionnaire. And we often get remarks on it, is much more in-depth than most typical new patient intake forms.
Of course.
It's way beyond just what meds do you have, what allergies do you have, on your demographics. It's, okay, going way back, childhood conditions and diseases.
Sure.
It's a lot of lifestyle factors, just to let us know. How are you sleeping? How would you say your diet is? How's your support system at home? What's your stress at? But we just want to hear from them subjectively, like, how are your foundations to health again?
Yeah.
You know what I mean? Like, where is your mental, emotional stress at? What are major events you've had that may have been traumatic in your life? Because, yeah, as you guys know, unprocessed emotional trauma is actually a main driver for dis-ease, lack of ease in the body. And so we could be using all these high force physical interventions that might give them some improvement, but it's not resolved. That's why. It was never a lack of a nutrient that started that disease. It wasn't the root cause. It's that emotional trigger.
Yep.
And so that's where it's really important for us to know how to best support the patient. So we give them the opportunity there on the intake form to share about all this. And then we go over that during the consult. And then we'll usually dive in deeper. And we remind our patients that the more holistic we can support them, the better their outcomes are going to be.
Absolutely.
And for someone that's maybe not ready to dive into those things, it's okay. But we just let them know, hey, when you are, this is going to be really important for us to get into. And what's nice is having a integrative, a holistic practice where we can support them. If they are ready to dive into that, if they are willing to share, if they're aware and maybe it's easy for them, but they just haven't done any work, we have options. And what's great is that there are a lot of options, both that we offer and that we can also refer to. And so some of those options might be as simple as acupuncture for the mental, emotional trauma or disease. It could look like referring to a motion code practitioner.
Yep.
Yeah, a great therapy. It might involve NET in office. And then higher tier, it's going to involve things like ketamine assisted psychotherapy.
Yeah.
And so what's great is that there is, I think, more and more research in that space to show the emotional connection to disease. And so there's more and more modalities. There's more and more options that we can offer. Yeah. And even to a certain degree, hypnosis, NLP, just in our dialogue. Just being really intentional with the language we use and using encouraging language. Yeah, as we speak, we create. And the intent behind them. Yes. Absolutely. And just being intentional about remembering that any challenges we've gone through is an opportunity for us to heal or grow from.
Yep.
And reminding them that no matter how difficult of a situation, we don't have to be victims to that situation. And I think language is a powerful way to program the mind, and we can support them. We can be that like ripple, and we can plant the seeds in someone that has really just been closed to the idea of healing. And they're like, oh, like this is actually something I can heal from. I don't have to suffer from this thing I went through. It's like, no, you can be free from it. We just get to do the work, and if we're able to do the work holistically and create great soil, then any seeds you plant into it are going to really flourish.
One of the greatest predictors of fibromyalgia is if you've had a traumatic experience as a child. That's highly researched.
100%.
And it's sometimes just mentioning that to the patient, to say, hey, this is what actually is most likely causing this issue.
Yeah.
Have you even talked to someone about that? Or have you even been told that by a provider? Or have you just been given medications and injections to try to mask this pain that you're having that more than likely isn't, like you said, treating the root cause?
Yeah, and I'm glad you mentioned that because I actually see a lot of patients with fibromyalgia.
Okay.
Yeah, a lot. And I loved going there, not because it's maybe fun per se, but I love going there because it gets to the root of the issue.
Yeah.
And I would say absolutely that research is spot on from what I've seen clinically. I would say 9 out of 10 patients that I see with fibro have gone through some form of serious childhood event and trauma. A lot of times for women, it's actually sexual abuse is a big one. And it was really shocking for me growing up, realizing just how prevalent that was. But I think that was also a motivator for me to these women and support these patients, realizing just how common that is. And it doesn't, not necessarily always sexual abuse, but some form of abuse or trauma. Might be physical abuse. Recently I had a patient who had a really physically abusive mother growing up, and she didn't even really realize that was abnormal. For her, that was the norm. And it wasn't until later in life that she realized, like, oh, that I had a really traumatic childhood, and that is now driving the fibromyalgia. And so she was one of these patients that was open to that idea and is wanting to do the work. And we're supporting her to release that trauma, heal from that, while also supporting the body, because there's definitely other, I would say, a lot of things that are associated with that, mineral deficiencies and mitochondrial dysfunction. But it's interesting because the emotional trauma may very well be affecting the mitochondrial function. Draining them, exactly. And the body's constantly processing this, and I think in ways that the research may not even be able to allude to yet.
Yeah.
We're getting there. We're getting there, but it's just depleting. It's backing up the system. Yeah. Some of these concepts and some of these things could be, you can dive into it biochemically. You can know exactly, this receptor and it's because of this. But I think sometimes we just got to think of it just more common sense wise. Sure. If you've got a drain, like a hole in the bucket, our bucket of energy or vitality, and it's just constantly seeping at it. The mind's constantly ruminating. There's emotions that we're not even aware of in the fascia. It's going to lead to depletion eventually.
Agreed.
Wow, yeah, that was incredibly well stated throughout, and I absolutely love your approach to not only just the clinical aspect, patient care. I love the questions, how deep that goes, because that then goes back to the root cause, and I think that's where a lot of people, especially the doctors I've talked to in the past, that they have certain modalities and they only look through that scope of, oh, I can help this and this, I may be able to help with that, to where you have so many things that you can use to help a person. But I think you go to that extra level of not only the psychosocial side of things, but also in the physical side of things, which not many people I feel like have. So I definitely commend you on that one. In terms of how you teach individuals and patients, is there a set time that you spend or can anticipating your schedule for a person based on either intake or previous care you've had? Or what are the other ways that you like to teach patients, and how do you go about that process?
And that word was dossier?
Docere.
Docere.
Docere, yes.
Thank
Yeah.
you.
Well, you have a French spin to it. I like it. Yeah, that's right. Yeah. Docere, yeah.
If you ask our staff, they're going to tell you I spend a lot of time, or partners and colleagues, a lot of time teaching. Passionate about it, guys, that I will often go over the allotted time, and when I notice there's someone that's interested in it or hungry for the docere, I like to go there. And you did mention something really awesome about our field that I love is how many tools there are. And because of that, we can support people with so many different conditions and goals, even if it's optimization, prevention. Prevenir, that's actually another naturopathic principle. Yeah, prevention.
Prevention. Okay.
Yeah, that's the cheapest approach, the cheapest medicine, right? But yes, so when it comes to knowing how much time do we get to spend with the patients, that's where that clarity call can often be helpful. Our front desk will also ask briefly what the goals, what the focus may be. And so we have different initial consultation fees. In general, we have our general new patient consultation fee, but say it's something really focused. So myself, for example, I do a lot of injections, regenerative injections. So if someone's just wanting to have their knee treated because they have arthritis and they're starting to have some pain and a little bit of swelling, and they don't want to do a full health consultation, then that's going to be a lot less time.
For sure.
And if that's the case, we won't book as much time. Maybe it might be a 30 minute to 60-minute initial consult to still get as much lifestyle as we can. Even for those that say, hey, I just want the knee injected, doc. I just want to be out of pain. I don't want to dive into everything. I still like to plant seeds. It's hard not to when you know the value of doing that.
Of course.
And you know how much better the results are going to be, or longer lasting. And so I really advocate for my patients, whether they realize it or not. Most appreciate it. I would say there are certain patients that are, I like to call them like the cowboys, like where they just they want the shoulder better.
Yep.
And they want to be out of pain, and then they're going to go back out and they're going to rope that calf or do the hard work, and then I'm going to end up seeing them again because they re-injured it because inflammation's low, and they don't want to change the diet from the conventional steak and potatoes.
Yeah.
And it's okay. That's okay. We'll still support you, and we'll help you avoid a cortisone shot, which I know you guys have done some content on, which is great, so it doesn't break down tissue, and I think it's still a better option. But ideally, we're going to be supporting them holistically. We just won't need as much time for those patients versus someone, say, with fibromyalgia, which is going to be more complex. We're going to get more information and may spend up to 2 hours. I like to say an hour and a half to 2 for a new patient consult. Every once in a while, with someone that has explored a lot of options, maybe they're on a lot of supplements, I want them to put their money toward what's effective. So I'll invite them to bring those supplements in, we'll go through, and I'll let them know, okay, hey, this is great, keep taking this, but this is not likely underdosed or not the right form of B12, and so let's get you off that. Let's get you onto something different. And that might go up to 2.5 hours, 3 hours even for that first patient consult.
Wow.
Yeah. And so I definitely push it in regards to what is typical.
Yeah.
And I also just, where is the patient at? Where is the patient? I have some patients, they're just, okay, doc, what about this and that? And they got their list of questions and they're just hungry. And so I'm like, okay, here's water. And not just physical water, but I remind them living water. Connect with that as well. But then there's other patients where it's a lot. And so we just start small.
For sure.
You know what I mean? And so it's really about finding out who is this patient, where are they at, what are they wanting, and then giving them a treatment and goals that are achievable, because everyone wants to feel successful. And I've also learned early on, it's tough for someone that hasn't taken anything to start taking 12 supplements.
For sure.
Even if there might be tremendous value. And so I've learned, okay, let's start with the 2 or 3 highest yield.
Yep.
And is that doable for you, honestly? And so then fine tuning from there and then adding more in. Yeah.
Good one.
I'm really curious. So I know you brought up supplements many times, and it's actually a perfect time to bring this up. Is there certain supplement companies that you like? Because I know we've touched on this in the past. Not all supplement companies are regulated on what they put in to their supplements. Is there certain brands that you feel comfortable with having people, even if it's a little bit more spendy, go into a little bit more?
Sure, yeah.
Or do you make your own, or is that something you'd like to do?
It's definitely something that I would eventually like to do. Right now, we do work with one local manufacturer.
Nice.
Yeah,
Is that OHS?
It's not.
It's okay. I just had to throw it out there.
Yeah, no, OHS.
Why I brought it up, Alan, is I met an OHS guy at this conference over there.
Thank you.
So I was like, you gotta be kidding me.
Yeah, that would have been quite the success.
Anyway, we'll bet it. But anyway, go ahead. Sorry.
That's really neat.
So not OHS, but the company we use is locally is called Goal Wellness.
Okay.
It's manufactured by one of our Goal Wellness.
Okay.
Yeah, manufactured by one of our docs in office, actually.
Wonderful.
Yep. And so what's nice there is that while it's not my own brand per se, I get to have a lot of input in the formulation. And so some of the formulas that company has made have been because of our combined insight, or hey, it'd be really great with this in there instead. And so, yep, that's a way of definitely getting a humble way of supporting with good, high quality products. And so that's a great company. But then outside of that local manufacturer, there's not any one company in particular. I use whoever I feel like is providing the best quality at the right dose, the right therapeutic dose for the best price.
Which dose is missed a lot. People don't understand that.
100%. And I think that is where a lot of people face challenges with supplementation. They're taking the vitamin and then they think, man, I've been taking this a month, nothing's changed. And then I talk to them, I say, hey, we'll bring it in. And it had 200 milligrams of magnesium. And that's not therapeutic. We needed 400 to 600. Or what's another common one? Fish oil. I see fish oil underdosed a lot. Or something I'll tell my patients regularly is if you see cyanocobalamin, you almost know. Just
not good.
That's not good.
Okay.
The formulator did not take the time to pick one of the bioavailable. Exactly. They went for cheap. And it may raise blood levels, and so they may go to their doc, and the serum levels of B12 might look good, but it doesn't mean the cells are able to utilize it.
And you're promoting more methylcobalamin?
Yep.
Is that okay?
Methyl, another popular one that some of the newer products I'm noticing uses adenosylcobalamin, also very bioavailable, not as popular, but methyl or hydroxy, most being methyl though, in case they have like MTHFR mutation.
It's starting to be more commonly found. I didn't realize that.
Absolutely.
So Doc, I would assume that the way that things go in your clinic regarding taking blood work, prescribing medicine, some of the things that people might actually experience in the hospital is also different too. I would assume that there's more comprehensive blood work and maybe other types of philosophies with prescribing meds. Naturopaths can prescribe medication, correct? Yeah. Yes. Do you want to just maybe touch on that briefly with what that looks like in comparison to the modern medical setting?
The blood work, you're spot on. It differs a lot. So what we recommend for our new patients, and then also for our follow-up patients, if we have something new coming up, is comprehensive blood work. And so when we say comprehensive, what does that mean? It means not only the basics, CBC, CMP, lipids, HbA1c, the average blood sugar over the past 3 months, but we like to look at fasting insulin, cortisol, the rest of the hormones, inflammation levels, nutrient levels, vitamin D is a huge one, magnesium in the red blood cell, because it's way more sensitive than serum, is one example. Yep.
And that's a blood.
That's a blood test. Yep. They look at the amount of magnesium in red blood cells, which is the main storage for magnesium. Serum levels in the blood don't change drastically. And where you're going to be able to detect a deficiency way sooner is if those stores are running low.
Interesting.
Yeah. Whereas it's got to be pretty severe for it to show up in the serum.
Okay.
You know,
So we've gone too late.
Too late, way too late.
Interesting.
Yeah, something's way further along. And so that's something where it used to be really costly actually to run, but the labs we've been working with more recently have brought the cost way down. I think the technology's improved. I'm not exactly sure why, but it is way more affordable for us to run that. And so when we look at comprehensive labs, we're looking at everything that's going to be able to tell us, is there a disease currently going on? And then, is there a disease beginning that we can prevent? And that's missed tremendously. And that's why we do a ANA, a basic autoimmune screen. It's not specific for any condition, but it's very broad and sensitive. It's not perfect, but that along with everything else can give us a way better picture of health. And even the hormones that we get are much more comprehensive than most other clinics that are supporting patients with hormones. Now, I think bioidentical hormone replacement has tremendous value. We use it a lot, but I see it done very poorly, I would say, in that they're just supporting testosterone, for example, and they forget about progesterone, they forget about DHEA, they forget about the cortisol levels and how are the adrenals doing, which are the manufacturers of DHEA, a precursor hormone that is then going to lead to testosterone and then ultimately estrogen, or is going to allow for progesterone to be naturally higher because it's not going to be converted to DHEA. Even when we're looking and supporting someone with hormones, I would say even that is more comprehensive than is used at many clinics out there. And so if someone has blood work already and they've gone in the last 3 months, we can utilize as much of what they just recently got and then just fill in the blanks. But a lot of patients of ours, they haven't had blood work in the last 3 months, or it wasn't as comprehensive, or they haven't gone to see a doc in 8 years, but they finally felt comfortable because they're like, here's someone that's not just going to push a medication on me. And so I feel more comfortable, and so we'll do that comprehensive. And it's really great because we're able to catch so much early on and fine tune. And we also do something that we like to run, and we're considering doing this for everyone. So far, we've only done it for those that we suspect a need for, but it's a cancer panel. And for men, one of the labs that will typically be looked at is PSA, right? One thing that we do look at in all men is total and free PSA, because total alone doesn't really give us a good idea of, is there something going on right now? A lot of things can change total PSA levels, sexual activity the night before, an infection, inflammation in the body. But when you look at it with in relation to the free PSA, that gives us a much better idea of, is this potentially cancer? And it's still not perfect, but it's more accurate. Yep, that we do on everyone. But there's these other cancer markers that we can run in both men and women. And those tend to, across the board, elevate before you can actually see pathology on imaging. So it's just, and again, the price for that has come down a lot, but it's definitely like a little more cost than the other things. But it's getting to the point where it's not significantly more, and we're considering incorporating it for everyone. And our hope is to be able to catch cancers much earlier on, because cancer is something that we treat as well. And I will say it's much more challenging to treat, of course, the further along it is.
For sure.
And so if we're able to catch it early on, it's going to respond a lot better and more easily to the treatment approaches we have. Even though cancers that are further along may also respond well, but it's going to require just much more intense and powerful interventions, frequency, IVs, and all that.
I have a scenario for you that I'm excited because I think when I talk to a lot of holistic providers, they have the very same philosophy with it. But let's say a patient comes in, you do this comprehensive blood work, cholesterol is high. Now, typical modern medical setting, they love throwing those statins, right? How does that differ in your practice? Do patients look for medicine from you, and of course are met with a different philosophy? How does that? Because you can prescribe, doesn't always necessarily mean you do. Well, how does that look, or what does that look like with conversations with patients?
Yeah, absolutely. We can absolutely prescribe, but I'm going to very rarely be prescribing a statin.
Got it.
I think they're some of the highest side effect profile medications out there.
For sure.
And I think it's done so negligently, knowing that they're going to deplete CoQ10,
Yep.
and yet they are giving patients statins left and right.
Yep.
And so I'm very often opposed to statins. There are few cases, such as in oncology, where the studies do show that a low dose statin can support outcomes with certain cancers.
Right.
Very interestingly. And I have used that, and I will use that with some patients, given that we're giving them CoQ10, which we're going to deplete, right? Not being negligent. It's just like a patient on metformin, which we know it's going to deplete B12.
Okay.
It is, and I keep saying negligence, but it's absolutely negligent to give someone metformin and not B12, because it's eventually going to lead to neuropathy or increase the risk of dementia, right? Something else. And can prescribe them. We often don't. Well, where we're going to go for someone like with high cholesterol is it's going to be like lifestyle to start, because we know exercise increases HDL, lowers LDL.
Yep.
We're not so concerned with total cholesterol. This is something that all the providers at AW know. It's like in Europe, the normal for total cholesterol not long ago was 220, and before that even 240.
Right.
And so total cholesterol is necessary for the body.
Yes.
It's what vitamin D is made from. The heart and the brain loves ketones. And so cholesterol by itself is not the issue, but the good and the bad, the HDL, the good, and the LDL, and those being out of ratio, that we definitely see increase the markers for heart disease, right? So hsCRP, inflammation in the heart. And so that is something that we will work on. And one of my favorite medications for those that can tolerate it is good old niacin.
Yeah.
Yeah, and not even the extended release, the flush-free. The research does show the one that works the best, least harmful on the liver, is just regular old niacin. And there is a blend that we use that does have a form that does not cause flushing.
Okay.
But I haven't, to be honest, I haven't done a deep dive into the effectiveness, but it is a product that does lead to results that I've seen for patients that don't want that flushing effect. But another option as well is taking a baby aspirin before the niacin.
Really?
Yep, that's actually the flushing. Okay. Exactly, yep, which will still give results. I usually, baby aspirin I'm not strongly opposed to, although in the elderly it has been shown to still increase bleeding, gastric bleeding.
Of course.
But I think that is there's certain medications where the benefit outweighs the risks.
Right.
But if there's something natural and a patient wants that, then that's often preferred.
Yeah.
We like to go that route. So yeah, for cholesterol, we're thinking more lifestyle, we're thinking maybe supplementation. And if niacin doesn't do it, there's other great things like pantethine. Not a lot of docs know that, but you can give pantethine. Not only is it going to support the adrenal glands tremendously, a B vitamin, but it's also going to improve lipids about 20 to 30%. Yeah, and and that's not one, that's actually something that I know. And even, and some of these things I didn't learn in med school, but I learned it through, that was actually something I think I learned through my father, but other old school naturopathic doctors, such as a great mentor I had, Dr. Axelrod at Sonoran University. Yeah, she...
Okay.
You feel like you know the name? Yeah. She's been around a long time, and outside of, I mentioned Dr. Timmermans, Dr. Axelrod is an incredible naturopathic doctor. And I actually, from my first shift in clinic, I was fortunate enough to get her. Normally, her shift is only for students further along.
Sure.
I happened to be placed in her rotation and just fell in love with her because I could tell she was just informed, experienced, and effective. And so then I requested her, year after year. And so that's something that we use on her shift as well that she was aware of. But yeah, and there's other options as well for supporting cholesterol. But I really love supplements and herbs because they're often going to support with one thing, like in this case panthenine, supporting with cholesterol, but it also is incredible for adrenal fatigue.
Yes.
And so the adrenals love it.
I think we have a
So
epidemic of that.
Before we get into the next one, I know we did a pod on this, hasn't come out yet. NAD. Do you use that, and is there certain times when that gets incorporated into a patient's care that you've seen?
Absolutely. So we do use it, and we give it as an IM injection at lower doses or an IV. And as you guys might have gone into in that pod, it's just got to be dripped a lot slower because of the potential side effects it has. And when we use it, so in patients with chronic fatigue syndrome seem to respond to it. As far as I know, there's not a reasonable or accessible way to check levels that we're doing. And so it's often an empirical test, right? So we give them an IM shot, or we do the IV and we see how they respond symptomatically. And if there's an improvement that's compelling, it's often a sign, okay, you were low on NAD. And we definitely have patients that have had long-term chronic fatigue, even some family members where nothing would touch it. They were hooked on stimulants or they have autoimmune disease. And we provide the NAD and it just changes their lives. Mental clarity, energy. And then there's patients where they don't notice much improvement and it's okay. You didn't have a lack of NAD. Maybe you still having mitochondrial dysfunction, but it wasn't because you didn't have NAD. Right. And yeah, NAD we use in office. While I don't recommend it a lot, I know that there is some pretty decent research for NMN being done orally. Yep. And I've also seen recently or heard recently that long-term niacin supplementation will also can lead to similar improvements. The body will convert it.
Because it's a similar, is it a precursor?
I believe it's a precursor.
Yeah.
So it will eventually be used to make NAD in the body. Yeah.
We brought niacin. I was like, I gotta ask that question.
Sure. Yeah. No. And it's a great question. Something else too, just along those lines, that I am starting to utilize more, and I'm seeing kind of incredible use for it, is methylene blue. Are you guys?
I'm so glad you brought that up.
Yeah. Yeah. So methylene blue is a compound that used to be just used for basically low oxygen conditions or carbon monoxide poisoning. And so it's one of the few things that could recover the body from that condition. It's being used off-label now for increased mitochondrial function, and it's also strongly antimicrobial. So it is very antimicrobial against Lyme, for example.
No way.
Yep. And so methylene blue is being used both as a way of improving energy levels in the body, but also for chronic infections.
Wow.
Mold, Lyme, and certain other pathogens that might be latent in the body, EBV, CMV. We're wanting to implement IV, but as of now, it's oral is how we recommend it. Yeah. But eventually, what we'd like to do is provide it in conjunction with ozone.
Just gonna ask that question.
Were you guys just
I
gonna?
think this
Yes.
is a great time.
Yeah.
We can get into that.
Okay. Perfect.
How does that look like in your practice?
Yep. As of now, the ways that we provide ozone, where we originally met Doc,
this all started
at an ozone conference. Yep. How we like to provide it is the good old-fashioned MH way, which is major auto chemotherapy, where we take the blood, heparinize, it doesn't clot, and then we add it to a partially filled saline bag, and then we ozonate it. Okay, that's a pretty traditional way. You can get up to about 18,000 micrograms of ozone doing it that way. But then there's also the high dose method. And that's a way, it used to have to be done with pumps. And so then you do something like a 10 pass. And that is certainly something that can be done. The machine we have is a German machine. It's called a Zotzmann. And it's one of the best ozone generators on the market. The challenge with it, though, is that the parts or the supplies all come from Germany. And there's only one importer that is tough. it's been tough to have a reliable source for the supplies for it.
Understand.
But it's a great system. It actually will infuse the ozone under pressure. And so it creates a hyperbaric-like environment for the ozone, which makes it even more effective.
No way.
That is something that the other methods on the market don't do and isn't even talked about much. Yep. And to be honest, I don't know that we have a study showing the difference, but from their use, and in Europe, ozone's been used. Ozone wasn't used for a long time here in the US, and then it had a resurgence. Over in Europe, they didn't have that, so they just have way more clinical evidence. And so from what they've seen, the Zotzman is one of the superior machines for a 10 pass.
Yeah.
Now, one thing though that does make up for, so if we're just doing if we're not using the Zotzman, there's still a way that we can get a higher concentration of ozone than just the MAH, and it's using a high dose bag. So just think of a large, like 1,500 ml bag, where you can put more blood and then you can put more ozone.
Yeah.
The Zotzman and previous forms of ozone would just do a 1-to-1, one part blood to 1 part ozone. But what we've learned is that you can safely take it up to 1-to-4, 1 part blood to 4 parts ozone, so long as it's not too strong of an ozone, like a 70 gamma, pretty standard strength. You can do 1-to-4. And so you can do 300 ml of blood, 1,200 milliliters of ozone. And so you can get up to about 80,000 micrograms. So it increases the amount you can provide. And what we do in office is that we combine that with UV light, UVBI.
Yeah.
And so we do a method where it's going to go through a quartz cuvette that spins the blood, and you put that in the UV machine, 12-inch. We used to have 6-inch, but they've since kind of improved the tech, and now it's 12 inches of UV light. And so we do that as it's passing back into the body. So the UV light, from what we understand, it's going to activate or upregulate some of the immune cells that are in there. And it's incredible, right? It shows how we're connected to nature so powerfully. And just that light exposure, it's going to cause the immune system to go after things that it wouldn't, produce more of the substances that are antimicrobial, or the compounds, rather. And I believe part of it is similar to ozone in that it's a form of hormesis to some degree.
Sure.
And for those that have been watching your podcast, they probably know, but that's when we stress the body a little bit, the body responds to that stress because we're meant to. And so we bounce back even stronger. And that's similar to what's going on with ozone even. When we put the ozone into the blood, that's a strongly oxidative compound.
Yeah.
And it's going to, of course, kill any pathogens, rather that it touches, but it's also going to interact with the immune system by creating ozonides. And that's basically when ozone interacts with something, it creates ozonides. Those ozonides are going to interact with the immune cells. And then that's going to lead to the upregulated immune system. And that's going on. And then you have that happening from the ozone, then you have that also happening from the UV light. And then once you get up to higher concentrations of ozone, that's also going to break down to oxygen. So then you end up getting more oxygen dissolved in the plasma, which is responsible for carrying some of the oxygen in the body outside of the red blood cells. So,
which generates so much healing potential.
So much healing, exactly. And so you're having this oxidative stimulating force, and then you're also providing one of the key factors for healing and energy production. So it's a really nice combo. And then eventually adding in the methylene blue is going to add in this other layer, which we can also run through the UV light in the cannula, and it actually photo excites the methylene blue.
Wow.
Yeah. And the methylene blue is able to have better results as it's photo excited, it's called. Yeah.
That's incredible. I've never heard that application before.
Yes. It's a more modern use, and I think part of it is because of the research and what's being revealed. And to be honest, I couldn't even speak to exactly how that's happening just yet. But what I do know from mentors that are doing this is that it does make it more therapeutic. Yeah.
Interesting.
Uh-huh.
So what are just a few of maybe the conditions you most commonly use ozone with?
It's going to be chronic infections. Okay, that's one of the best uses that are most common uses in clinic. We'll also use it for acute infections, although we're usually going toward one of our other IVs, something like a hydrogen peroxide IV or a high-dose Myers cocktail with a lot of vitamin C, a lot of the minerals, zinc, maybe even glutathione. But early on in an infection or with chronic infection, oxidative therapies tend to be more effective. So that's like hydrogen peroxide, that's ozone, or that's like high-dose vitamin C. Yeah. Yeah, we'll also use it for cases where people want to optimize, and that's more because of the oxygen component. In those cases, ozone is a consideration, but so is something like hyperbaric oxygen. That's going to stimulate stem cells that I think has more research showing stem cell stimulating effect and platelet stimulating effects. But there are patients of ours that will notice increased energy and mental clarity from the ozone without any detectable infections. That's not to say they don't have them. There's a lot of pathogens out there that I believe we can't detect yet. We haven't been able to detect. And so that might be going on, but certainly just increasing the oxygen in the plasma is going to lead to things like that.
And I can speak on that. When Micah was in last, we were talking about ozone, and that was the same thing. First time trying it, practitioner from Sugaro came on over, did a session with me, and it was incredible clarity, energy for a good few days, week or so straight. And then I also used it with a couple other patients, nothing but good things. But he was saying that for the initial visit, only about 20% of people have noticed effects. It takes about, what you guys were saying, 5 to 6
A little
or
more
so.
session, some people want that one and done, right? But got to be realistic too.
Yeah, so the IV menu is what you're asking about. Yep. And Dr. Lee has done a great job putting that together for us. So let's see.
You don't have to go over all of them.
Oh, yeah, we won't go over all of them. Just, some of the most popular. It really depends on what the goals are.
Of course.
But some of those other IVs that we'll do include chelation to help detox heavy metals, which has also been shown to help tremendously with atherosclerosis, coronary artery disease.
Which is another test I'm sure you do that not a lot of people know even that you can test.
Yeah, that's right.
Causes issues.
That's right. Yep, definitely. And so that heavy metal toxicity is rampant here in the US, whether it's because we grew up close to farms, maybe a lot of seafood with mercury.
I feel like it's high in Arizona, like air quality, things like that. I don't know, I have this feeling.
Yep, no, it absolutely is. And one of the heavy metals that's typically higher here in Arizona is arsenic. And that's partly because it's used, I don't know if it's still used, but for a long time it was used on cotton fields. They would spray it on the cotton, and it's actually what would help to dry the cotton and get it ready for harvest. There's a name for compounds that do that. But so a lot of the soil, and then eventually a lot of the well water will get contaminated. So chelation is definitely one of the IVs that we do. We'll also do compounds like plaque X, phosphatidylcholine is what that is, right? Which we know orally we can take. It's one of the constituents of lecithin. When we do it IV, it has a stronger cell membrane repairing effect. Yeah, and so that can be used for different conditions. We do a lot of high-dose vitamin C and integrative oncology. There's a couple other IV herbal extracts that we can provide, one being artemisinin. Yep, and so that's a really interesting compound because it's got a lot of use for the immune system and a lot of support for being used adjunctively with a lot of cancers. And so that's what that comes from is wormwood, actually. And so Artemisia is what that comes with. And so that will often do, say, as a push, following or immediately before our high-dose vitamin C IVs. And then they work synergistically. Let's see, we do ALA. Yeah, we do. No, please.
Do you, not to throw you off course, but there is an uptick now in more weight loss focused compounds. Is there anything that you throw or support that avenue for patients?
Yeah, so weight loss, Usually we're taking more of a supplement approach. In IVs, what we can provide, which I will say can help, it's not dramatic,
Of course.
but it's going to be things like carnitine.
Yeah.
Carnitine we need to transport fat across the mitochondria. And so whether we're breaking it down and accessing the energy or forming it, we need carnitine. And so for someone that's already putting the body into that fat loss, that weight loss mode, that's going to be helpful. There's certain amino acids we can use. What we'll also consider is adrenal support, because if we're having high cortisol levels being pumped, that's not going to let the body burn fat. That's going to put it into fat storage mode. Yeah, and so that's going on quite a bit.
Do you guys dabble with the glutide therapies?
So we do.
You do? Okay.
Yeah, honestly, we do. And we do it really judiciously.
Of course.
And we have patients that were requesting it for a long time, and we were a little hesitant, but we decided that if they're gonna, when someone's interested in a therapy that's elective like that, semaglutide, they're gonna find a way. And either we get to support them in doing it more holistically,
Of course.
and safely,
Yeah.
and reducing the harm, or they're just gonna find it, and then they're not gonna be told the importance of protein, and they're gonna have muscle wasting,
Yes.
and then they might have indigestion and really poor constipation because they're not being provided with an herbal stimulant or a digestive enzyme or fiber, being told to increase fiber. And so we do use compounded semaglutide.
Okay.
Yep, which we'll either have patients come in for, or we can send them home with a kit.
Yep.
And what we're very clear and adamant about providing informed consent and letting them know that there are cases where the side effects are so severe and have led to long lasting of the stomach. And again, I know those studies were in patients that were doing higher doses
For sure.
and having higher side effects. So we use it until we see more research, what I consider a safer range. The lower, kind of again, minimal effective dose. The lower range, if you're starting to have side effects, then we don't want to go up from that and push the body. And so yeah, we've had actually patients have a lot of success with it.
Do you like to play in the microdose kind of way of prescription, or do you tend to just do typical doses? I'm just curious.
We'll usually do typical doses.
Okay,
yeah. I know there is some research showing interesting use of it in the microdose and the lower.
Myself.
Absolutely.
Better ways for people. I've heard that it's not, sometimes it's effective, sometimes it's better. It's usually just how a patient responds to it.
Absolutely, which I love that it's still developing, and I'm open to learning, because I think if there is benefit for certain patients at the lower dose.
I think they hear the word microdose and they're already like assimilating that with just trendier words of microdosing. And of the patients that I've actually worked with, the typical dose tends to work really well. So I never really played around with the microdose yet.
And so maybe room for all of us to learn more about. But the typical dose is just on the lower end.
Perfect.
Yeah.
So, Doc, with the background, whether it's Reiki, whether it's NLP, hypnosis, craniosacral therapy, how do you utilize either each one of those or certain ones for certain patients' presentations that they come in? I'm sure there's a psychological component to all this as well, and how you choose each modality. But I guess, do you want to speak on either whether it's each one or what your methodology is?
Yeah, absolutely. It's always going to be patient specific, right? And depending on what's going on. In general, though, all patients, and they may not even realize it, but are having NLP practices used with them. Going back to just the power of language, being really intentional with the words that are chosen, such as creating opportunities to heal and openness to letting the body heal itself, restoring health, reminding them that, and I actually have this on my business card, that health is our birthright. And so we're simply restoring what's been promised to us. What is ours? We're just claiming it.
So what is NLP for people that may not?
Yeah, so it stands for Neuro-Linguistic Programming. Right? And so it can be used in more formal ways, but how most people will use it is they incorporate it into whatever they're doing. Yeah, early on when I was learning more about NLP, there were a lot of critics that said, oh, this is a form of mind control, right? You're wanting to, yeah, in a way, you're wanting to influence or control someone. But it's really silly because patients are coming to us to improve their health.
Exactly.
They're wanting good outcomes.
Yep.
And so we can talk to them in a way that's going to lead to a positive impact to them
Yes.
feeling more hope,
Yep.
less despair.
Yeah.
And a lot of patients, they're looking for hope.
Yeah.
They've gone to everyone and they have not gotten the results. They're told they're crazy. They're told that it's all in their head.
Oh.
Unreal. It really sad. And so NLP is all about just programming the mind using verbiage. There's more that goes into it. There's maybe certain gestures or eye gaze and focus and different ways, but it's really all about influencing an individual, selling an idea, right? And so I think we're all salesmen, or saleswomen, whether we realize it or not, right? We're selling something, ourselves, a product, a procedure, modality. And what we know is that the more that we're on board with something, the better the outcomes. And that is something important to know in our patients because we talk a lot about the placebo.
Yes.
Very few people talk about the nocebo, being the exact opposite, being basically you can take a drug, and if you're told it's a sugar pill, and they did studies giving people anti-hypertensive medication, so high blood pressure medication.
Yeah, okay.
It's like almost across the board, this medication lowers blood pressure. These patients were given it and were told this is a sugar pill. They monitored their blood pressure. It didn't change at all. It's incredible because it shows our mind can block a pharmacological substance from working.
So they were given a drug, told it doesn't work, told it's not effective. Yeah, and it didn't work.
It didn't work.
I've never heard of that study before.
There's a similar study at Stanford, a milkshake study. Same thing. They're given a milkshake. One was a healthier one. The other was, this is gonna have all these effects, and exact same milkshake, different outcomes in terms of blood levels and all that. Yeah, it's incredible.
It really is. And I want to say the book, I think it was Bruce Lipton. I want to say The Power of Belief. Don't quote me on that.
Okay.
But he talks about the nocebo
Yeah.
effect. And so it just goes to show the power of the mind, right? Like you were saying. And so we can impact our physiology with what we're believing. And so NLP really, I know I've said it already, but it's just a way of supporting the mind to be on board with what's going on, being open and receptive. And so that is something that we'll use in dialogue, really day to day and everything. Not always intentionally, but what tends to be a little more intentional is like using hypnosis. And so where I've learned to use hypnosis, not like typical maybe therapists would do it, but I use it a lot of times in combination with regenerative injections.
Okay.
In patients that have needle phobias or even not. And so I'll support them and do a form of regression while we're doing the injections.
Okay.
So that one, they're in a more relaxed and calm state.
Okay.
Two, we're already getting the mind on board to be open to the outcomes that are about to happen.
Yes.
Because a lot of times with chronic pain, you have a lot of wiring and that for years pain. And so what we know is that the longer something like that goes on, the thicker the wiring in the brain. I think this is going to be a nice segue into something else we're going to talk about. But that pain is so habituated that there is something to be said about cellular memory and a tendency to start feeling that pain, even though the pathology's gone. And so it can reactivate. And so what I have found is that the injection procedure is better received and the outcomes are better if during the procedure, patients are thinking and feeling what it's going to be like to be out of pain. Wow. And so in a mild hypnosis, you can achieve that. And so that's what I'll often do, and I'll combine that with a couple frequency devices to help.
I was just going to ask on that too.
A couple to help the cause. So I'll have the patients on a PEMF mat, pulse electromagnetic field. Just relax the nervous system, get the parasympathetic going, increase blood flow. And then I'll use an FSM, frequency specific microcurrent. So like tens, but not with the aim of contracting the muscles to relieve pain, more specific frequencies designed for certain conditions.
Of course.
Yeah, and to help those certain conditions. And so the machine that I have has a whole list of codes for different conditions. So rotator cuff, back, migraines, headaches, whatever it is, yep, and muscle pain, joint pain. So I'll use it with the most similar frequency for the condition we're treating. And so there's a lot going on, but patients find that they're less distracted or put off by the injections because I'm not using general anesthesia. I actually find that the feedback, so them being awake, actually really helps because for one, they're able to let me know, oh, that's recreating the pain I get. So that's good feedback. Doesn't always have to be the case. It's also nice because I'm often using some form of anesthetic in the solutions. And so if they let me know, hey, the pain's gone and we're not doing nerve blocks, it's also a way of knowing, okay, we've treated the pain generators.
For sure.
Right there in that area.
For sure.
Yeah.
That's beautiful. So where does Reiki come into play? And have you used hypnosis during a Reiki session with different frequencies?
Yeah, so how Reiki comes into play is in just about any hands-on or whenever we're shifting from the consultation to now we're doing some kind of therapy. And it's, while I'm trained in Reiki, I'll sometimes do it in the formal traditional sense if we're doing body work, which I will do, or physical manipulation. But a lot of times now in practice, after doing this for a couple years, it's become more of the entire time I'm treating them, I'm imagining this light flowing into them, and I'll incorporate that into the hypnosis. So I'll actually invite them to see what the Reiki practitioner is normally doing, which is using light or imagining the symbols of Reiki which embody these healing frequencies and moving that energy into an area or through the person. I'll get them participating in the healing, which is usually well accepted because a lot of our patients, I will say, they do have some spiritual practice. I think one thing that they appreciate about AW is that we're openly faith-based. And so that means we're going to be talking about mind, body, and spirit.
Yes.
Reminding them that health is being created from below, but healing's coming from above, from something greater than us.
Yes.
And so I think most of our patients, it's nice that they, whether they're Christian or whatever their background, they are open to that.
Yeah.
And so I have found it more effective, more calming when they are aware and feeling what's going on.
Yes.
So you guys can imagine right now, imagining light coming into our body, as we're breathing, or maybe from above. And then beyond that, not just imagining it, but feeling it. I think that is honestly more powerful than us just visualizing something. And so that's where during the hypnosis it's helpful, because people that might not be too imaginative or have that ability are able to do that more easily. They're able to imagine and then also feel this healing coming into them. And sometimes I'll even not only have them imagine breathing it in, coming from the crown, but even through the needle. And I know and imagine a healing sensation in the area we're treating right now.
Yeah.
And as the light's coming in, imagine the cells being restored to health and like feeling that healing, and then imagining, and then going from small, really focus on the tree, to then the forest. Okay, and now imagine your life as if you didn't have that condition. What are you going to be doing? How are you going to interact with your family? What are the things you're going to go out and do?
Yeah.
And so what I typically will do is walk them through a day, just a day in their life, like fully healed, in optimal health, and what that's like.
You're literally creating neuroplasticity through the mind. Yeah, it's incredible. Yeah. How many sessions does it usually take to create that change? Obviously, that feeling's there, and then they get put into the real world. How many sessions for untypical have you experienced that can help with certain things for this type of work?
Yeah, if it's combined with the injection therapies, it varies a lot, but it could be anywhere from 1 to 6 sessions. In general, the longer something's been going on, the longer it's going to take to heal.
Of course.
Yeah. But there's also those cases where they are just so receptive, they're so ready, and they really allow the injections to work. We have the diagnosis dialed in, we treat those pain generators, and then they're out of pain. The first patient I ever treated, similar to the woman I saw as a kid, 18 years of back pain, hooked on opiates, one treatment of neural therapy, with some of what I've described right now involved as well, and his pain was gone. And in 3 months, he was able to taper off the opiates. He didn't cold turkey, like I believe that woman did, but he eventually got off. And so that's possible. Now there's another woman that I've treated, actually mother to a fellow colleague, who brought her mom from Chicago that was having just devastating, complex regional pain syndrome. She was told she was going to live with pain forever. They had tried everything. Her kidneys were being affected. She had undiagnosed reactive arthritis.
Okay.
Really complex case, a life of pain. Ever since this colleague of mine knew her mom, she was in pain. Like not a day went by without her mentioning pain to some degree. And over the course of a year, doing treatments at about a month to a month and a half to start. Okay, we did about 3. Then it went to every 3 months. Then it went to every 6 months.
Okay.
Now I see her maybe once a year. She's out of pain. Yeah. And so it definitely was a very compelling case. It took definitely repeat, and she would stay on top of the pain too. So before it ever came back to the point, she's, ooh, I'm noticing we're not progressing anymore. We're starting to regress. Let's go in. So I think her outcome was so profound because we were able to rewire the pain circuits and signaling. Yeah.
That's a complex case too. People don't understand what CRPS. I mean,
Yeah.
funny enough, we had just a CRPS patient a couple weeks ago come in. Man, more of those cases are looking for providers like yourself. People, I hope people that are listening that have, please. I know what you've been told. We know what you've been told. And now there are support groups for these patients because they have to deal with what their providers had told them, that they're going to live with this forever. They have no hope. Like you talked about, just the words that these providers have used have taken away their spirit.
Knowing the power of our words, right? Seriously. We've been talking about using them for healing.
Seriously.
But how providers really are poorly informed, and they'll say so quickly, give someone a certificate of pain for the rest of their life.
Yeah.
I
like the way you put that.
Yeah,
It is.
right?
And you did it. Unfortunately, you got to own that. You did that.
Yeah, and I think as more research supports what we're talking about here, they're gonna see the harm that they did, and eventually that, I hope, is going to be incorporated into medical school curriculum.
Yes.
Be very aware and intentional with the words we use, because there are so many patients out there that have been told, you are going to deal with pain. And if you are one of those patients, know there are so many options. There is hope, and not to give up or even subscribe to what one of these providers has told you, and without exploring all those options.
Agreed.
Yeah.
Beautiful.
And so I know there are some patients that are on their journey, we'll call it, and let's say along the way they maybe need some help, maybe diving into themselves internally. And I know that ketamine therapy can be something that might bring them farther along in that journey, but there is also other options or utilization of ketamine. So with ketamine, Doc, first let's maybe just, how do you determine a good candidate for ketamine? Let's maybe start there.
Yeah. Okay, to start off, while we use it for severe mental health conditions, there are certain mental health conditions that we don't want to use ketamine with. One being, for example, schizophrenia.
Okay.
And so if someone has a history of schizophrenia in themselves, possibly even with the family, they may not be a good ketamine candidate. Okay? And it's usually going to be used for patients. So for right now, it's approved for several conditions. So treatment-resistant depression,
Okay.
PTSD, chronic anxiety, and it's being used more and more, and we're using it for chronic pain as well.
Lovely.
Yeah, yeah. And so patients that are wanting to take a more, I would say, intense or quicker route to rewiring and doing the work and letting go of trauma that they might be aware of or not, ketamine is something that we're going to consider. Now, as of right now, for ketamine, it's not covered by insurance, or at least through our clinic. I think some insurances are starting to, so that's something to take into account is the investment. I think for what it's able to do, though, in such a short amount of time, it is so worth it. It is so worth it. So there are different ways of using ketamine. I know early on we were talking about how it can be IM or IV. We do an IM administration of ketamine. And so what that'll look like is a smaller dose to ease the body into that dissociative state, very light dose, to also see how the patient responds. Because based on our metabolism, everyone can respond a little different, and then a larger bolus. And we're following a protocol that has been really well studied. I think one of the most well studied, but by no means the only way to do it, the only protocol, but we do 2 sessions a week for 3 weeks.
Okay.
Yeah. That protocol seems to increase something called BDNF, brain-derived neurofactor, to a certain high point, which afterward it may not be increasing any further, possibly, or at the very least within that amount of time, raises it to levels where neuroplasticity is really easy and rewiring is happening really easily. And people are having durable, long-lasting effects. Yeah, and it's incredible. And I know ketamine is often, when you look it up, a NMDA antagonist.
Okay.
Blocks
Yep.
something, a receptor in the brain that's for learning. It's really interesting because that might not be the main way that it's leading to these long-lasting effects, let's say improving depression or healing PTSD. And so for us, we're finding that it's able to accomplish what would normally take months and months of work in a short amount of time.
So beautiful.
Yeah, especially if someone has an intention, and I think that's really helpful. I think
That's people. We're coming to talk about the journey, right? Maybe they have to be ready for that.
I think so. I think yeah, it's not for everyone, but who it is for is those that are wanting to overcome and let go of something.
Yep. Yep.
And it seems to be best suited for those, to be
Yes.
honest. If you're not really aware, it's possible that ketamine could bring certain things up in the experience,
Yes.
and then that could be helpful at revealing what gets to be what worked on. Why have I felt this way? But it seems to be most powerful with someone that is somewhat aware of what they're wanting to work on, what caused them getting to that point. They're ready to let that go. They're ready to rewire, and they're ready to also change their behavior.
Yes.
Because that also is important. It's going to put the brain into a very neuroplastic state. Rewiring is going to be as easy as it can be.
Yeah.
But if we're not willing to let go of some of the behaviors that have been triggering or leading to depression or anxiety, it may not have those long-lasting effects.
Sure.
It might just be short-lived.
Sure.
Yeah. And it's fascinating. I think we're going to be learning more and more about how it's working.
What do patients explain they're feeling when they're going through treatment? Are there any adjectives or words or that they explain they feel?
Yeah, there's definitely a lot of...
It might be a spectrum.
It's definitely a spectrum, but in general, it's similar to a lot of psychedelic experiences out there in that it is surreal and it is freeing. And I think that has to do with its dissociative aspect, right? Because it's a dissociative anesthetic. And so it's like a profound, eye-opening experience. Extremely insightful to say the least.
I've been wanting to try ketamine ever since I started hearing about it.
There's a clinic I know.
No, seriously. Oh man, I just know so many people that would benefit. So many people.
Absolutely. I think here in the U.S., as certain Native American cultures have described, is there is a epidemic of mental illness, and not even Native American cultures, but we just know that from literature and just from the rates of suicide, suicidality, depression, anxiety. It's rampant.
COVID was a catalyst, I feel like.
Huge catalyst. It just, I think, brought so much to the surface and worsened so much. We were already struggling, and then we isolate, we lose that social connection, and it just worsened everything. And so it really showed how we are in desperate need of connection with ourselves and with those around us. And ketamine, I am really excited for, because it seems to be this just incredible medicine that lets us remove the barriers that have been getting in the way of us enjoying our life really quickly, and just get back to having good connection. And I think there's a lot of lifestyle factors too that are helpful along the way. A lot of what we've talking about, kind of supportive stuff that goes hand in hand, but having something that can quickly remove the story I've created, right? Because that's a big part of it, is the story around our life experience. And we can get out of that story of victimhood and trauma and embrace the story of opportunity and purpose. That's way more empowering.
And we become quite vulnerable in that state, though. I would assume most patients aren't quite ready to be, unfortunately, vulnerable yet. But I think there just will come a time where that person is absolutely ready to be free. I like the word, freeing was a good word. I liked that. And I know a lot of men don't like to be vulnerable.
That's a tough one.
And I can about imagine what that looks like on their journeys too, but some who are just ready for it. I know that I have a background, recovering alcoholic. I'm now sober, going to be in 10 years in April. So I know that that's got to be one of the larger populations that is there any ketamine research with addiction too?
Yeah, that's a great question. So off the top of my head, for addiction, there is some research with it being used. I'm not as familiar with that, and don't always turn to it for that. But if we just think about how it's working, it's letting the brain be rewired.
For sure.
Even though there's not maybe as strong of research for it, it's just based on our understanding so far, I can see huge value with it. I know there are other psychedelic substances that have been well researched with addiction, with incredible results. I want to say ibogaine.
Okay.
And that's something that, thanks to podcasts like Joe Rogan, they've really been highlighted. Yep, they've shined the light on that. That's a psychedelic that has a longer acting effect, but after one session, it's gone many.
That's incredible.
Not just alcohol, but heroin. And a lot of the psychedelics in general, any of the compounds that allow for brain rewiring in a quick amount of time are going to support with overcoming addiction.
For sure.
One study that I am aware of, interestingly enough, is that a medication often used for addiction, Naltrexone, was used in conjunction with ketamine. And interestingly enough, so naltrexone blocks opioid receptors. It's an opioid receptor antagonist. So it's actually used, I believe, off-label, and I've even used it for addiction to alcohol, to support with that. And this study was really interesting. They found that the ketamine, when used in conjunction with this medication, did not have as long-lasting effects. And so it was showing how the effects ketamine has on opioid receptors is part of how it's helping with long-term outcomes. So it just goes to show how it's really dynamic, and there's a lot of things going on.
I can't wait to learn more.
To learn more, but could absolutely be, I think, considered and will be used for many more conditions in the future.
Beautiful.
Yeah. Beautiful.
Yeah, that was a great question, Doc. Have you used ketamine therapy with any other modalities? Let's say to get someone, paint a picture, whether it's someone's incredibly anxious, depressed, and they wanting to get better, or is there ways that you can use other modalities to help get them there in conjunction with ketamine therapy for a little bit of a more of a
Maybe a runway
Yeah.
to ketamine.
Great.
So, guys, getting back to the therapeutic order that I mentioned, in an ideal scenario, we've worked with someone to establish the foundations to health, and we've worked with them on their hormones, on their inflammation, on their nutrient levels. And then we do the ketamine. Yeah, that is ideally how we prepare someone on the physical side of things, while them doing the journaling on what they're going to want to do before the ketamine, right? To bring the mind on board as well. And then we combine it, and then the ketamine definitely tends to have more like wholesome results, right? Because we're not trying to overcome depression that was being impacted by vitamin D deficiency.
Smart.
Which is going to absolutely create a improvement, but then ultimately those symptoms are going to come back. Why? They were lacking a key underlying factors. That is something I think that also sets us apart, and a good ketamine clinic is going to be doing that lifestyle, that diet, that modifications and nutrient support. Because there are a lot of clinics, especially here in the Phoenix Valley, where you can go and get ketamine right now. We can go out on the street.
With a low resistance into it, you're saying?
Yeah, very easily. Very accessible. We go in and we fill out the paperwork, and next thing you know, we're having ketamine dripped into us. Now, the outcomes though, and the outcomes are going to be diminished. And it's important to know ketamine does have a moderate risk for abuse. It can absolutely be abused.
Why? It sounds phenomenal.
Oh yeah, an immediate increase in feelings of joy, lower depression. Exactly. And so it's got the immediate benefit and the long lasting. But what we have seen in the research, what we've seen in practice is the more of that psychotherapy component, the integration too, a phone call the day after to talk about what's come up. Really with any of the psychedelics out there, that integration is so key, such a huge component.
It sounds like you have a phenomenal way to prepare and then monitor, but you're probably not going to get that at a place that just allows you to come and get it and leave, which wouldn't be the right way to do it, in my opinion.
Correct. In fact, we have a patient that did go to one of those places before, and so had an experience with ketamine already. And in comparison, she said she was impacted by it. She was like, I had no idea it could be like this. And she actually shared with us that the previous ketamine where she just got it, they put her in the room, got the IV going and left, was almost more traumatic because things were coming up. She wasn't prepared. She didn't have anyone to support her in processing. And so for her, it almost did more harm. And so I think that is also important to point out, is that how something is used, in what setting,
Yes, of course.
right? Like we've heard before in a lot of the psychedelic research, set intention and setting, the environment is so key. So in the clinic, we also have a really cozy environment. What we pair the ketamine with is noise canceling headphones with a playlist and a eye mask. We use these mind folds where it's got foam padding, and so you can blink but not feel anything. And so you go into just your own sacred space. And then there's someone in the room with you as you're going through it if you need, but otherwise you're in your own experience for about an hour. Yeah, very safe. Got a blanket if you need, nice and cozy. And that'll last about an hour and a half. And then as you're coming out of that experience, there'll be someone there to talk with you. Hey, what's come up? Check in, do some of the integration work.
That is going to be trailblazing these next 5-10 years.
I think it's going to be a model. I think more and more clinics are going to see the value, but they're going to get this powerful medicine, and let's just take it serious. Let's have the integration. Let's have the space. But yeah, I agree.
That was incredibly insightful. Yeah, my mind's blown. There's a lot of patients that I know, and also people, potentially family members, that I think definitely get better through certain things that you guys have. We're definitely going to be keeping in touch on that side of things.
So Doc, how do they find you? What
Yeah,
would be the
please.
easiest way for them to maybe want to start working with you? How does that look like? How should they get that?
So they can go right on our website, which is www.awhealthinstitute.org.
Okay, we'll have the links for the page too.
Awesome. Yeah. And so they can go on there, they can submit their info, and then we'll reach out to them. They can also feel free to just give us a call.
Okay.
Yeah, giving us a call at our phone number, which you'll have there. It's the same phone number we've had, I want to say, for over 20 years. My dad got into VoIP early on.
Yeah.
And so we've got the same number. We got people calling us after 10 years.
You got it in the yellow pages. It's still the right one.
It's still the right one. Oh yeah, we were there. Yep, the local newspaper, all of it. And so they can give us a call at that number and also send us an email. And all of those are great ways.
Perfect. Thank you so much today, Doc. This was such a great experience. I appreciate you coming on and sharing everything. I hope everybody who's been listening has enjoyed what Doc has been saying. And again, please reach out if you need his help, because I just know that he is going to provide you with such great care and help from just the experience I had today with you. So again, thank you. Thank you so much. And again,
Absolutely.
we'll be in touch.
Yes, sir.
That's everybody. Have a great day. Doc, until next
Absolutely.
time, you guys have a wonderful day.
Thank you guys so much. Yeah.
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.